Welcome back. In your morning medical news, the CDC is contradicting the health secretary on COVID vaccines for kids. The CDC now says children 6 months and older with no underlying health conditions may receive COVID-19 vaccines after consulting with their doctor. The updated recommendation directly contradicts Health Secretary Kennedy, who said last week COVID vaccines are no longer recommended for healthy children and pregnant women.
Translation for shared decision making, that means talk to your doctor. Now, not everybody has a doctor, by the way. 1 in 3 people in this country do not have a doctor. So that's one challenge. In terms of the kids, we know that kids under the age of 2 are those highest risk after the elderly for ending up in the ER or the hospital. And okay, most of them are not going to die, but as a parent, I don't think you want your kid to end up in the ER or the hospital.
Definitely not. Vaccines for pregnant women are still not recommended by the CDC and are now listed as no guidance, not applicable on the agency's website. The American College of Obstetrics and Gynecology still recommends pregnant women get vaccinated for their own health and for the protection of their baby. And your morning coffee habit might be doing more than just waking you up. A new study looked at women in their 50s who drank 1 to 3 cups of caffeinated coffee daily. They were more likely to reach older age, free from major chronic diseases, and maintain good cognitive, physical, and mental health. Researchers acknowledge lifestyle and dietary factors, but the lead author says coffee itself might play a role. For the first time in his life, a young New Jersey man is pain-free thanks to a new gene treatment working to cure patients of sickle cell disease. Jenna DeAngelis has more on the groundbreaking treatment.
It's a milestone moment for Gerald Corte. Ringing the bell means completing his treatment for sickle cell disease.
It just felt really great to know that that chapter of my life is over.
So happy and so thankful.
All his life, the 18-year-old has suffered from the debilitating side effects of the rare and life-threatening inherited blood disorder. He needed frequent medical care and couldn't play sports. Even the cold triggered painful episodes.
Most of the time I'll just be inside because I was in pain.
It's been incredibly painful for his mother, who lost her oldest son, Emmanuel, to sickle cell when he was 7.
It's been rough. And there was no treatment at that time.
Now there is. Gerald is the first patient in New Jersey to be treated with groundbreaking Lyfgenia treatment outside a clinical trial and following FDA approval in 2023 for patients 12 and older.
What's going on? How you feeling?
Treated by Dr. Stacy Rifkin-Zenenberg at Hackensack Meridian Joseph M. Sanzari Children's Hospital.
The gene therapy treatment is a treatment where we are essentially curing patients of their disease.
She explains doctors collect a patient's blood stem cells, which are then genetically modified in a lab. The patient undergoes intense chemotherapy before the modified cells are infused back in the body to produce new healthy red blood cells.
Just to endure just a few weeks of pain for a lifetime free of pain it's definitely worth it.
Gerald plans to head to Penn State to study nursing and psychiatry, inspired by those who helped him.